next I'm going to demonstrate the process of inserting a nasogastric tube into your patient. So again, prior to any procedure, you want to make sure that you have washed your hands, and also we want to verify that this patient has a physician's order for placement of a nasogastric tube before you begin. Once you have done both of those things, then we're going to think about gathering our supplies. Our supplies include a towel or some kind of pad to drape across their chest. You want to make sure they have ice chips. You want to make sure that you have a stethoscope. And then we've also got our equipment, the actual NG tube, which is a Dobhoff tube typically, and you've got an anti-reflux valve that goes on the end. You've got tape to measure how far then the NG tube is going to be inserted. You've got lube to make it easier for insertion, as well as this is the butterfly bandage that you're going to place on the patient's nose to secure the NG tube in place. And then we've got a septo syringe or a 60 ml syringe to either aspirate contents, and in our case we're going to hear a whoosh in the stomach like I mentioned in lecture, and we're going to do that by the asepto bulb syringe. So once we've gathered all of our supplies, we're going to raise our bed up to make sure we're in an appropriate position. Give me no Christmas. It'll be just okay, that was super speedy. Now let's raise our actual bed up again. And as mentioned in lecture, you might also use something like lidocaine spray or a numbing jelly to place on the tube, or the lidocaine spray to spray in the back of the patient's throat. So beginning, this is a clean procedure. It's not a sterile procedure, it's a clean procedure. We're going to drape the patient's chest with something just to make sure nothing gets all across their freshly cleaned gown or their bed linens. I typically will take the pillow from them, tell them to hold their head straight up. Your book does say to leave the pillow there, so when you begin insertion, so they can lay their head back against it. But in my experience, I find that just taking the pillow from them helps with the ease and movement of their neck. And you also want to make sure you have suction canister and a suction regulator here set up for once you insert the tube. So we are going to go ahead and set up everything we need. This is the Dobhoff tube. The reflux valve is going to be connected to it here. Blue goes to blue. We are going to ensure flexibility of the tube. We just kind of, and you'd be wearing gloves, and we're going to ensure flexibility. We're going to kind of swunch it up some and make sure we have that good to go. Then we're going to use lubrication jelly. We're going to squirt that out and be sure that it's ready to go. Your asepto will attach to the clear port here, so the air will push through the tube itself and go into the patient's stomach, hopefully. We want to be sure they've got ice chips at their disposal. Before we insert it, we are going to measure. You're going to measure from their nose to the tip of their ear here, and then to the xiphoid process. And once you have measured, we're going to mark it with a small piece of tape. And then hopefully we would have already assessed the patient, asked them which NUR is going to be most appropriate for insertion, if they ever broken their nose, or which NUR is just they breathe better out of. You want to keep up with your connector piece. This is going to connect it to suction. So we're going to take the pillow from them. Your textbook will tell you to hyperextend the neck back against the pillow. You don't have to hyperextend, but you want to tilt the head back far enough to visualize the nasal cavity, because you want to get around and beyond the posterior interpharynx. So you're going to visualize the inside of that nasal cavity, and I'm going to make sure I've lubricated it up. You're going to tell them that they're going to feel it against their throat. It's going to make them gag, but that it's okay when they need to swallow, they have to swallow to ease the insertion. So I'm going to go in. You can feel it made a little resistance at the posterior pharynx, and you're going to kind of twist. And then once you get around the posterior pharynx, their head is going to bend forward. You're going to tell them swallow, swallow, eat your ice chip, swallow, 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 until you meet your already pre-measured insertion site. At this point, you're in the stomach, you'll probably be getting some gastric contents back. If not, we're going to press our bulb syringe. And you should hear a whoosh or a bubble or gurgle in the belly. Whoop, gurgle. So we're in the correct spot. Now, we don't want to forget that before we're going to hook it to suction, before we're going to do any kind of feedings, we are going to confirm this with x-ray placement. But you will still use this particular method in the hospital, and if you have pH strips, you can also aspirate some gastric contents and test those contents for acidity to ensure that it's gastric contents. To secure the NG tube in place, we're going to take our butterfly dressing. You put it gently across the nose, and then you wrap these wings around the tube itself. So once we've got that in place, and we'll say that we have checked our gastric pH, and so we know, or we check the pH of the contents, so we know we're in the stomach, we're going to connect to suction by using your connector piece here and by hooking it up to the suction canister. And then at this point, in the hospital, sometimes we kind of tape it to the bed here just to make sure it doesn't tug and pull on their NUR. We would be sure to call for x-ray placement, a KUB, just to verify that that tip of that tube is in the proper spot in the stomach, it's not up against the stomach wall, and we are going to get good outcomes either for bowel decompression or possibly feeding in the near future.